This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
We are going to enter a period of increased stability over the coming 5 years compared to what we've experienced in the last 2. Most states are finished with Medicaid redeterminations following the expiration of the public health emergency. There is some work being done to go back and capture individuals that perhaps inappropriately lost Medicaid coverage. That could lead to some incremental bumps in Medicaid enrollment in the next year or so. And from there, modest fluctuations. We're not expecting any major booms or any major attrition to the financial class otherwise.
Hello, welcome to Sg2 Perspectives. I'm your host, Trevor DaRin. I have my colleagues, Brian Esser and Tori Richie, joining me because we are going to do what we have done for several years in a row now, is talk about our insurance coverage forecast. It's a product we get to build together, and we refresh it every year. And there's always a lot of potential inputs, and we have to narrow it down and quantify exactly what we think is going to move within each financial class. This is always a fun episode to do, and it's fun wrap up to this project each year. Tori, I'll go to you first, as you're really the mastermind behind all of this, and you let Brian and I sit in the canoe while you paddle. Biggest picture, how should health systems think about how coverage is shifting for their patients over the next 5 years?
If I had to choose one word for health systems and how they're feeling amidst the changing payer environment, it's uncertain, maybe nebulous. We're tracking a number of different trends that are affecting how patients are enrolling across different insurance products. And because of the continued aging population, we're going to see an increased share of Medicare because of the expiration of the public health emergency, because of the eventual expiration of the ACA subsidies. We do think that there's going to be some modest growth in uninsured, but at the same time, there's increased pressure for employers to provide some amount of healthcare insurance to their employees. So that's helping to maintain or bolster even the commercial patient population. There's some modest fluctuations in here. There's a lot to keep track of, more than just where folks are enrolling across the product. Keeping a pulse on changes to payer patterns and payer activities, thinking through the shift that we're seeing from quantitative assessment of how to bill for hospital services to this shift of clinical necessity or clinical appropriateness that payers are now leveraging. This may result in increased need for prior authorization, perhaps even increased denials or downcoding of select healthcare-related services. That is the bigger story and the bigger implication for providers.
I'm going to break it into pieces, and let's start with commercial. That's probably the place you mentioned least in the setup, or a place that's dwindling at the expense of some others. What are the patterns we're expecting in commercial for the next 5 years?
Commercial, the biggest trend that we're seeing is continued growth in that high-deductible health plan space. This is an area that we expect to continue to grow over the coming 5 years, especially as healthcare costs continue to increase. In addition, employers are having to get really creative with how they provide healthcare benefits to their employees. So this might even look like passing on additional costs to their employees, even opting for an ICHRA-based arrangement, or even providing employees with a stipend where they source their own health insurance to keep costs lower on the employer side.
We've talked about that for so many years as possible, like we're waiting for it. Fixed contribution versus fixed benefit. And we're still waiting to see it happen.
We are. But Brian, I think that you've done some research in this area where it seems like this small subset is starting to see some growth.
The ICHRA discussion, and Trevor, I agree, has been back of our mind for years. A lot of chatter, not a lot of activity in the market. And from a raw number of employers leveraging it, we've actually seen it come down slightly over the past couple of years. But it's probably, Tori, to your point, reflective of the fact that we are still in a fairly low unemployment environment. There's a lot of need for talent across industries. Benefit design and robust benefits are one way to attract that talent into your companies. That's sort of stymied the overall ICHRA growth to date. We're sitting here first couple weeks of January. JP Morgan's going on. I'm seeing a lot of chatter coming out of that from the private equity side, and new firms being stood up to educate employers on the power that ICHRA may have for them to avoid 7, 8, 9% premium hikes year after year. Employers are tired of that. This discussion is going to continue. Do private equity dollars supercharge it and actually shift it in any way? Not quite sure. But the exchanges are as robust as they've ever been and as competitive potentially as they've ever been. So is the time that the exchanges could handle an inflow of lives through this mechanism happening now? Something we're definitely going to keep an eye on. One thing I'll add on to the commercial discussion at large is just the environment we're in and the overall focus on bringing commercial activity, employers, onshoring of manufacturing. All of that is happening in the theater today. And if we see more of an uptick of that kind of activity happening across the country with the influx of potential tariffs or other areas to bring those jobs back to the domestic front, does that supercharge our overall commercial base even more so? But even so, where does that actually happen? Which geographic locations benefit and which ones may not get as much of a boon? So it's going to be a very local discussion about your commercial base and what type of employers you have today, small, medium, large, and which ones may be attracted.
A comment on that rising cost of premium. It's interesting. There seems to be increased emphasis on prevention and wellness from the payer side. We've already gotten multiple notices from our health plan within Vizient about the importance of preventative care and wellness and connecting employees within the organization to resources that can enable those preventative services. I almost wonder, is that going to be the next phase of value-based care, where payers are starting to think through how do they reduce the total cost, the total burden with an increasingly complex and increasingly sick patient population? Do we start trying to de-escalate those patient episodes and then reinforcing the importance of things like wellness initiatives?
Yeah, I think it's definitely something they are financially incented to do so. Anything that has any kind of benefit, we're likely to see more activity from the payer side.
Say more about the exchanges. Brian, good transition to it there. We know subsidies may disappear at the end of 2025. How that impact our forecast?
We are at an all-time high in terms of marketplace enrollment. We were projecting that 2025 enrollment would hover pretty close to 23 million enrollees. We are still waiting anxiously for what the final count is. It's important to keep in mind that the expanded marketplace subsidies are set to expire at the end of 2025. What this has done is expand subsidy availability for individuals that were previously eligible for subsidies, but also made new patient populations, new enrollees eligible for modest subsidies. When these go away, that it's reasonable to assume that we're going to see a drop in marketplace enrollment from the administration, what their plan is with the subsidies. But if we're reading the tea leaves, it seems rather unlikely that these subsidies are going to be renewed. We forecasted HICS enrollment with this trend in mind. So we are projecting some modest declines in 2026 and 2027, getting to a new baseline where we then plateau and hover around the 17 million mark as it relates to HICS enrollment. So that's still quite a bit of growth if we think about where marketplace enrollment was just 5 years ago. But we do expect to come down from the high that we're experiencing today.
The overall peak that we're at, and it is a peak, so we should commend ourselves on seeing this market continue to grow in complexity and capability to host this number of lives, right? These are all folks that have insurance. We're hitting those marks. I do agree that the subsidy pressure will be present throughout 2025 and likely brought into several debates as far as whether we get renewed or not. It may be too early to tell. We don't have enough line of sight within the current administration as far as this is definitely going away or not. So I would caution listeners to not assume anything at this point. Even that being said, it's going to be hard. A lot of the pickup across the exchanges are going to be in states where, especially governors or others, are going to say, okay, does this make sense? I don't want a bunch of folks falling off with no insurance. And it's probably the same with the Medicaid space as well. Like, we need to keep an eye on how robust are these programs and as healthy as they are, and how do state and local officials think about insurance or uninsured and the impact on their local communities, and how do they message that up to the federal level as well. It's a bit of push and pull amongst all of those. And then it also combines with how healthy is the economy. And if we would ever see a slowdown, not saying we will, but there's going to be a mix of lives between commercial, uninsured, exchange, Medicaid. So that flux, it feels like, we're always going to be monitoring ins and outs as those different insurance classes swap lives in any given market environment.
Brian, you're the master of the transition. We'll transition to Medicaid. The last few years have seen pretty dramatic forecast changes. What's the next 5 years going to look like?
We're entering a period of probably some continued declines in the Medicaid space. This, again, is highly localized. It's going to vary state by state. In a state like California, where you have a more favorable outlook on the Medicaid program at the state level of government, you might not even see declines. You might see some modest growth here in the Medicaid population. If you look then at a state that perhaps hasn't expanded Medicaid, there doesn't seem to be very much state level support for the program, think Texas, you're likely to continue to see some modest declines here. We are going to enter a period of increased stability over the coming 5 years compared to what we've experienced in the last 2. Most states are finished with Medicaid redeterminations following the expiration of the public health emergency. There is some work being done to go back and capture individuals that perhaps inappropriately lost Medicaid coverage. That could lead to some incremental bumps in Medicaid enrollment in the next year or so. And from there, modest fluctuations. We're not expecting any major booms or any major attrition to the financial class otherwise.
Yeah, from an enrollment standpoint, I think all that's accurate. I would keep an eye, as far as Medicaid goes, more on the periphery of program design and really the state-federal interaction, because it does feel like that's going to present new risk points potentially for funding of the overall program. And we're talking about work requirements, block grants, other elements that structurally, if it pinches some of the dollars available to support this population, do we see a little bit of erosion based on those dynamics? Again, we don't know where that's going to land, but enough chatter out there that it's catching our eye and we'll be monitoring it.
Another place with a fair amount of chatter from the incoming administration and this week at JP Morgan's, particularly Medicare Advantage. I think I pitched to both of you an increase in the rate of growth of MA and a decrease in this potential forecast, but we landed keeping the status quo, which is pretty substantial growth. And we, at times, thought about levers that could pull that down. We thought about levers that could push that up, particularly in local markets for the last 2 years. Big parts of the debate have centered around pushback from providers. Will that trickle to patients? Will it outweigh largely economic decision that individuals have made around Medicare Advantage with $0 premiums, et cetera? And will one of the counterweights to that be payers not making as much money there? And so there's less availability of those $0 premium plans and less robust benefits. But in the short term, it doesn't seem like any of those forces are going to outweigh individuals' economic interest or like groups, unions buying as a collective. And so we're still forecasting robust growth in the shift to MA.
Yeah, summarized perfectly. The conversation that we were having internally is 2024 felt like a year of continued headlines related to negative press for MA plans, for lack of a better term. And it was important for us to recognize that while we might be aware of those headwinds, the average consumer likely is not. We exist in a unique bubble, and our members do as well, where we perhaps are acutely aware of some of the prickly spots around the existing Medicare Advantage plans, why we wouldn't recommend an MA plan to a family member or loved one. But when we think about the marketing arm that's really behind these payers and some of the incentives that are attached to enrolling in these plans, the average consumer likely isn't going to have access to the same level of information that we do. And that's what's going to help bolster some of the growth that we expect in this area.
I love the term prickly spots. I've not heard it described that way. That's a generous way of saying it. The enrollment trend in MA is right. There's no reason to believe that we're going to see a decline in MA based on the tension between payers and providers today. It continues to be a consumer pocketbook issue. The MA space for the provider set is a payer strategy discussion of how willing are you to engage in meaningful discussions with your MA payers. And if those don't prove fruitful and yields in MA as compared to traditional Medicare continue to erode, what is your organization's strategic decision point at that time? I'm not saying we should all exit MA, though we do have some organizations doing that, but think about trimming that portfolio of payers you're working with to those that are going to be at least somewhat collaborative around all the utilization management, audits, denials, etc., while also ensuring the consumers have access to the care they need at the appropriate time and place. It's going to be those more proactive payer strategy elements that we need to be thinking about internally, and with the ultimate reminder that in the middle of that discussion are consumers. If you don't accept their MA plan and they lose access to their primary care physician, what is our recourse there? How do we educate and bring those consumers along in a meaningful way so we're not painted as a problem or really causing these issues?
As long as brokers are still making $600, $800 per member they bring into MA, they're still going to be one of the primary sources of education for enrollees. MA was a place where there was a lot of potential speculation, and we decided we're staying the course for now. Tori, Brian, what are a couple other places that there's not enough info yet to call it a trend? It didn't impact our forecast yet, but it's something you're paying attention to across any of these financial classes. We touched on some of them in Medicaid.
The most important thing to remember is enrollment in insurance products is going to vary substantially at a local level. Having a good pulse on the types of employers that exist within your local market and the types of healthcare offerings that they're likely to be offering to their employees and their family members is important. Understanding where major marketing dollars are being invested from an MA perspective is also going to be a strong indicator of whether or not your market is going to have higher penetration than average of MA uptake. And then favorability of, government funded programs like Medicaid, certainly the exchanges, even as we enter a time frame where those expanded subsidies may or may not be available moving forward. You're going to see more fluctuation depending on how much support there is at a local level to fund some of those initiatives.
Yeah, I would throw out two items I'm keeping top of mind. And it's the turning of the dial within your insurance enrollment, but really payer mix. And as that dial for most markets continues to steer towards governmental, Medicare, Medicaid, what does that mean as far as revenue quality and ultimately our position or orientation between a fee-for-service environment versus value? And if we can't sustain margins fee-for-service wise on a governmental book of business that's likely to continue to grow, how do we reorient towards value-based care and risk? And if that's we're going to drive our margin, are we set up for that over the next 3 to 5 years? Understanding those local dials and exposure points are going to be important for all of our strategists moving forward. The other one is that, and I was just looking at our data here on our consumer surveys, 6 out of 10 adults still have problem using their insurance. So having insurance is great, and that's one thing. Actually being able to use it and have it pay for the care in a meaningful way that doesn't put a financial burden on the consumer is a totally different discussion. And how do we think through that portability of insurance and access? And just because they have it, are we actually showing up in a way that they can leverage their insurance to receive the care they need? I don't know if that's all on providers, but I think it's something we need to be aware of and understand where the frustration points might be coming up from our consumers.
Brian, I think it's a great point. Providers have such an opportunity to leverage the trust they have and build more with consumers in terms of helping guide them through the insurance marketplace. And I know it's a place a lot of providers, they don't feel comfortable. They don't want to spend their time doing that, but it can be a huge asset to consumers and, of course, to the health system if they're all in sync.
One other trend that I want to hit on, and we talked about this a bit at the onset of this conversation, that it's important for providers to wrap their head around the shifting payer dynamic as it relates to how healthcare services are being reimbursed on the payer. This is something that we've heard coming out of providers that are working directly with Medicare Advantage plans, but this is also trickling down to the commercial patient population, is this idea of payers identifying clinical appropriateness for care and reimbursing under those constraints versus historically a very data-driven approach. Think the 2 midnight rule is a great example. What we're hearing now is that payers are shifting away from using the 2 midnight rule to identify appropriateness for an inpatient stay and are instead assessing what they're calling clinical appropriateness, which means that a patient, even if the hospital deems them appropriate for inpatient, they might only get reimbursed for that observation rate if insurance deems inpatient the inpatient rate isn't appropriate. That has major implications on balance sheets. That makes financial forecasting much more challenging if we're dealing with a nebulous assessment of appropriateness instead of something that's truly data-driven. And this is a trend that absolutely favors the payers, but it seems like something that we need to be thinking strategically about. And how do we ensure that we are protecting ourselves from any cuts to reimbursement that might not be expected?
Well said. Good concluding thoughts. I always look forward to our conversations on this topic and look forward to continuing to work with you both on our insurance coverage forecast. Thanks for listening. Look forward to having you both as guests again soon. Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at Sg2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.